Hi, everyone. My name is Benjamin Ungerin, and I'm an assistant professor in the Department of Dermatology at Mount Sinai in New York City. And today I'm going to be speaking about a cross-sectional study of psoriasis, atopic dermatitis, rosacea, and alopecia areata suggests association with cardiovascular diseases. Here are my disclosures. And as I just mentioned in the introduction, here is the study that we published recently that I'll be discussing a little more, the association between certain inflammatory skin diseases and cardiovascular disease. So just for some brief background, the association between psoriasis and cardiovascular disease is pretty well established at this point and widely recognized. And then over the last several years, increasingly a similar association is being recognized with atopic dermatitis and cardiovascular disease, as well as two inflammatory skin diseases that can have systemic inflammation. The link between rosacea and cardiovascular disease and alopecia areata and cardiovascular disease, I would say, is a little less clear, maybe a little more controversial at this point. But there certainly has been some suggestion that there's a similar kind of association as well. And just briefly, the idea that systemic inflammation and cardiovascular disease are related is hypothesized or understood to be based on repetitive vascular injury, endothelial cell activation, and then a number of these factors indicated below. And so the fact that these inflammatory skin diseases are being recognized and understood and characterized as systemic inflammatory conditions really lends credence and gives an explanation as to why they may be associated with cardiovascular disease. And so for the study that we published, it was a retrospective observational single center study performed at Mount Sinai. We used the TriNetX platform to identify the patients and do the analysis as well. These were adults greater than 18 years of age. And as you might imagine from the title, they either had a diagnosis of psoriasis, atopic dermatitis, rosacea, or alopecia areata, identified using ICD-10 codes. And then controls were one-to-one propensity score matched based on demographic factors to allow us to compare the rates of the outcomes of interest. Those outcomes that we assessed for associations with cardiovascular diagnoses included, and again, these were based on ICD-10 codes, a very, very broad look. So all diseases of the circulatory system, a little more detailed where we looked at any of the following major cardiovascular disease categories, the ones that are listed below with the corresponding ICD-10 codes. We also looked at each of those 5 categories individually, and then lastly looked at either ischemic heart disease or cerebrovascular disease in combination. Additionally, when available, because there's access to some of the medical records, laboratory markers of systemic inflammation were also used as outcomes of interest, and that was elevated ESR and elevated CRP, so above the upper limit of normal. Again, markers of systemic inflammation. So for this study, there were over 35,000 atopic dermatitis patients, close to 20,000 psoriasis patients, over 12,000 rosacea patients. As you can see, definitely fewer alopecia areata patients, so about 3,000, and each group was matched one-to-one with corresponding controls. So, 35,000 controls for atopic dermatitis, 20,000 controls for psoriasis, and so on. And so in terms of the results, we look here at the odds ratios of the different diagnoses occurring in the psoriasis patients compared with the corresponding controls. And we see here, elevated odds of having a diagnosis of any disease of the circulatory system. Similarly, elevated odds of having a diagnosis of either ischemic heart disease or cerebrovascular disease. Any of the 5 major cardiovascular disease categories below, and then individually, one by one, each of those categories had elevated odds in psoriasis patients versus their matched controls. And then the markers of inflammation also were similarly elevated in psoriasis patients, both in terms of odds of having elevated ESR and CRP. Among atopic dermatitis patients, we see kind of a very similar pattern here. And so I'm not going to go one by one, but again, we see increased odds for all the different comparisons that we looked at. And I'll also note that in terms of ischemic heart disease or cerebrovascular disease, the odds were over 2, even higher than what was seen in psoriasis. And then similarly, we did see elevated odds of having increased ESR. It's interesting to note here that CRP levels actually showed a different relationship, and certainly that's something that we'll need to explore further in the future. Now, moving on to rosacea and then alopecia areata, again, with a little less clear-cut link, at least that's as it's understood so far, we did see, a very clear elevated odds ratio of any disease of the circulatory system. Unlike in psoriasis and atopic dermatitis, we don't see increased odds of every single one of the comparisons, but we did see, again, increased odds of having a diagnosis of any of the 5 major cardiovascular disease categories there, as well as hypertensive diseases, cerebrovascular diseases, and arterial diseases. And as you can see, the last category was quite elevated odds. And then again, kind of corresponding to what we see before, elevated odds of having increased systemic markers of inflammation, ESR and CRP. And then lastly, looking at alopecia areata, we do see elevated odds of having any disease of the circulatory system. The other kind of associations maybe are a little less clear-cut here, although there was a significant elevated odds of having any of the 5 major cardiovascular disease categories below, hypertensive diseases and arterial diseases. And I will note that, as I mentioned before, the sample size for alopecia areata here was quite a bit lower than the other categories. So it is possible that some of these associations don't yet have the kind of power to identify. And in fact, with larger samples, further studies, and so on, we may identify some of the additional associations that we see in some of the other inflammatory skin diseases. And then similarly, we did see for both ESR and CRP, those elevated odds of having, abnormally elevated markers. So there were a few limitations for this study that should definitely be acknowledged. This was retrospective in a single center cohort, so it may not ultimately be generalizable to the entire US population. It was based on electronic medical records to identify diagnoses, which on the one hand may limit its comprehensiveness due to underdiagnosis of both the inflammatory skin diseases as well as the cardiovascular disease. And there's also, of course, the potential for accuracy issues with misdiagnosis of all the diseases in question as well. This study also could not assess for lifestyle factors, which definitely could play a role in cardiovascular outcomes and diseases, and is something that would need to be addressed, in future studies that are able to assess for those factors. So some conclusions from this study, we do see an overall trend of increased cardiovascular risk for psoriasis, atopic dermatitis, rosacea, and alopecia areata. And additionally, the increased odds of the elevated inflammatory markers suggest that these diseases may be considered systemic inflammatory conditions, particularly and likely in subsets of patients that are more severe. And then ultimately, further research is needed to understand not only and to understand and characterize the risk overall for people with these inflammatory skin diseases, but as well as different subpopulations. For example, perhaps patients with more severe disease, as some studies have suggested, are at that much greater risk for cardiovascular disease. Additionally, we need to understand the ability to modulate these risks with treatment and ultimately the mechanisms by which these inflammatory skin diseases, and perhaps individually how these inflammatory skin diseases lead to increased cardiovascular risk. So thank you very much for your attention.